Hello, I'm Dr. Jane Morgan, a Bayer partner and cardiologist, and I'm here to talk to you about your heart health. In fact, there's a study right out of JAMA Cardiology that really has demonstrated that Americans' hearts are aging faster than the date on your birth certificate. For women, that means that our hearts are about 4 years older than our birth date. And for men, that means that their hearts are about 7 years older. Now, that is actually quite alarming because, as your heart advances in age, you become that much closer to mortality. So how do we begin to dial that back? Well, there's so many behavioral changes, and in fact, about 80% of heart disease is really related to behavior. It's related to risk factors like high blood pressure, high cholesterol, smoking, alcohol intake, mobility, how much you are moving and exercising. And so these are all things that we need to take into consideration, including diabetes. The main culprit oftentimes is medication adherence, just not taking your medications as prescribed. In fact, about 56% of Americans have high blood pressure, and many of those are either undiagnosed or they're not taking their medications as they should. So what are some of the things that you can do? Not only should you take your medications and try to move more, you can go to Bayer's website at seeyourrisks.com and take an assessment. A quick 2-minute assessment gives you an idea of where you are on your heart risk and gives you the tools to begin to have this conversation with your physician. We know from JAMA that this is not just a trend, this advancing heart age. This is really something that should be an alarm, an alert, and we can start to dial back the time and get ahead of it by mitigating all of our risk factors and making certain that behavioral changes are not contributing to our advanced heart age. Again, go to Bayer's website, seeyourrisks.com, and begin the process of embracing longevity.